Hi, my name is Blessing and I'm going to be a nurse today. So can you tell me your name and your date of birth?
John Edwards, February 1991.
Alright, so can you tell me what brought you in today?
Annual checkup.
Alright, I have a couple of questions to ask you. Have you had any change in your appetite?
No.
Do you have difficulty swallowing?
No.
Do you feel pain anywhere in your abdominal, like your stomach area?
No.
Okay. So have you how often do you have a bowel movement?
I need once a day.
Once a day? Is that a normal thing for you?
Yes.
Okay. How about your diet? Has there been any changes in your diet?
I've reduced what I've started eating.
What type of food do you eat? Can you tell me, what type of food you eat?
Just omnivore type stuff, vegetables, fruits, meats.
So how many times, in a day, do you eat?
2 times a day.
Is that a normal thing that you do?
Yes.
Routine? Okay. Alright, so I'm going to now inspect the patient's abdominal area, but before I go ahead and do that, I am going to ask the patient to bend his knees for me. So I need you to bend your knee up for me, so that way I can actually have enough access to the patient's abdominal cavity. Are you okay with me opening up your abdominal? Is it okay with you?
Yes.
Alright. So, patient has the patient has a round abdominal cavity. It's round, and so this is the right lower quadrant. This is the right upper quadrant. This is the left upper quadrant, and this is the left lower quadrant. And it looks symmetric on 4 quadrants, and it has the hair are actually equal, bilaterally, the hair is present. It has enough hair, which is actually portioned equally on all sides. So I'll need your hands straight, not on your head, and your knee bent, please. Alright, so patient's skin looks, are you okay? Patient's skin looks smooth, and there are no sign of blueness and of lack of oxygen. Has enough circulation of blood there, and there is a pulsation just around the PMI area, just around where the aorta is located. That is where there's a pulsation around there. And so now I am going to auscultate. So I'm going to listen to his 4 quadrants, starting from his right lower quadrant. So I'm just going to listen to your stomachs for any bowel movements, okay? And I'll be using the diaphragm. So patient has there is a presence of bowel movement around in all 4 quadrants, which it's a hypo. It's hyperactive. I believe that's where it's under. But there is actually a presence of a presence of sound of bowel movement, and I could hear them waiting every like 5 seconds to 30, between every 5 to 30 seconds interval. I mean, 5 to 15 seconds, I believe. So now I'm going to auscultate the aorta area, the right and left renal artery, and the right and left iliac artery. And I'll be showing the location as well. So here is a aorta artery. It's right here. Here's the right renal, left renal artery, the left iliac artery, and the right iliac artery. So those are the artery areas: the aorta, the right renal artery, the left renal artery, the left iliac artery, and the right iliac artery. So right now I'm going to precause all 4 quadrants, starting from the right lower quadrant. Alright, so I'm just gonna try to precause here, like to tap. Alright, so now I'm going to percurse around the liver and the spleen area, over the liver and the spleen area. So the liver is actually located around the right upper quadrant, which is just right about here. So I need you to take in a deep breath for me. That is around the liver area, I believe, that I am precursing over. It's dull, has a dull sound. And right around here is where the spleen is located, just right below the stomach area. So I'm just going to like kind of feels like it has a tympanic sound around that area. So I'm going to palpate all 4 quadrants, starting from a light palpation to deep palpation. So I'm going to start from his right lower quadrant, which is like right here. If you feel any pain, let me know, okay? And do you have any pain anywhere? Alright. That is, so here is my light palpation. And I'm gonna go over to the right upper quadrant area. Right there. And I'm gonna go over here. It's right there. Then the left lower quadrant. So now I'm gonna go into like a deep palpation, starting from here, the right lower quadrant. It's right there. You feel any pain? feel any pain? And then going over here. In here. So there's really no much body mass around there, around that area. So I'm going to palpate the liver area, which is just right here. It's located on, again, the right upper quadrant. It's right here. So it's just this area. I'm just gonna palpate that area. That is where the liver is located, right here. Can you take in a deep breath? And then the spleen is located over here by the stomach area. And can you turn your back for me, please? And the kidney is located here, just right here, this back. And it's just located around that area. So, do you have any questions or concern for me? All right, thank you.